Wache Miswe. Good to see everybody. Welcome to our webinar. My name is Jocelyn Formsma. I'm the Executive Director of the National Association of Friendship Centers, Moose Cree Nitoshchin. I'm from Moose Cree First Nation and currently live and work in Algonquin Territory, otherwise known as Ottawa. Thank you so much for joining us tonight. And this is one of many webinars that we've had in our series, and Take Care in COVID and Take Action in COVID. Part of the way that we want to contribute to ensuring that people have good information to make the best decisions for themselves and their families and their communities. It brings me great pleasure to have our guests today, Dr. Ryan Giroux and Dr. Brent Young. We'll introduce them more formally in a moment, but I want to kind of walk through a couple of logistical things for folks who have been on a few webinars in the last couple of years. You'll be familiar with this, but just want to make sure we're covering it off. So this webinar is being translated simultaneously. So if you would like to hear the webinar in French, there is an interpretation button at the bottom of the screen. It looks like a little globe. So at the bottom of your Zoom page, there should be something that looks like a little globe, a little world icon. Click on that and you can choose the language that you prefer. As we're going through, we've structured this in a way to be conversational, to provide information, but really a forum for people to ask questions and to have their questions answered in real time. And so if you do have a question at any moment, at any time, feel free to use the Q&A function. Again, if you go to the bottom, there should be a Q&A button. You click on that and you can write in your question, and we will include it as we are going through the questions to our panelists today. We certainly want to hear from you. Again, this is our opportunity and our way of creating a forum to have questions that you might have answered, or if you've been seeing just too much information going around and are having a hard time sifting through what's real, what's good information, what's out of date, what's maybe not the best information to rely on. We certainly want to hear that, because we want to make sure that you have trusted information from really good sources, again, to make the best decisions for yourself and your families. So this is the title of our webinar is called Keeping Our Children Safe. We're hosted by the National Association of Friendship Centers, of which I work. And we've heard that as the vaccines have been rolling out, firstly to more of the elderly population and those with many vulnerabilities, to adults, and now it's been recently approved for use in children. We understand that that can be very scary, especially with kids who can be vulnerable in their own ways, also very resilient. And so we wanted to focus this webinar specifically on pediatric information of the vaccines, to dispel misinformation out there, and to really build confidence in maybe information that you have and you're like, is this the best information? So we want to give you the most up-to-date that we have today. Now, the way that we've approached all of our work is, meeting people where they're at, coming forward in a non-judgmental way. And so if you do have questions and you think you might be judged for it, we really try hard to not be judgmental in the way that we're responding to these questions. We really want to provide the opportunity to have people feel comfortable asking things the way they need to ask them, even if it sounds silly or if it is coming from a place. This is the time to I guess clear the air. And the way that we've approached getting that information is we go to people that we trust. We go to people that we feel have a really good handle on the situation, who won't be touting conspiracies from anywhere, but will give you real talk from the realities on the ground. And so that's why we have Dr. Ryan Giroux and Dr. Brent Young. So Dr. Ryan, can I call you Dr. Ryan? Dr. Giroux? He's a Métis Pediatrician, member of the Métis Nation of Alberta. Grew up in rural Alberta, and prior to completing his Bachelor of Arts in Anthropology in Edmonton, and completed medical school and residency at the University of Toronto. He now lives and works in Toronto at St. Mike's Hospital and the Inner City Health Associates in Toronto, focusing on urban Indigenous health, child health, and newcomer refugee health. He's currently a clinician at Adouje Minu Niseo, I know I probably pronounced that wrong, Place of Healthy Breathing, which is an Indigenous COVID testing and vaccine clinic. And Dr. Brent Young is an Anishnaabe Family Physician, and he's an academic director for Indigenous Health at Dalhousie Medical School. He's working with the Mi'kmaq Native Friendship Center to develop culturally safe and relevant primary care services for the urban Indigenous population in Halifax region. And he's recently been working on a new Indigenous admissions pathway and developing sustainable supports for an increased number of Indigenous people who will be joining the medical profession. So thank you both for joining us. And it's great to see Indigenous doctors in direct practice working with and for our communities, and just appreciate your time here today. So I'm just going to pose a starter question. I mean, I think, we all acknowledge that there's a lot of information out there and it's coming from all directions. And a lot of it has to pertain to, or it pertains to the pediatric vaccines right now, both fact and fiction. So before we open up for questions, I'm wondering if each of you could share what you think is the most critical piece of information that you'd like people to know about pediatric vaccines, or correcting any misinformation that you've seen kind of populating out there. Either one could go first.
Sure, I'm happy to go first. Oh, we both unmuted at the same time. So I just wanted to say Tanzi to everyone. I'm Ryan. I can go by Dr. Ryan. Ryan is also fine. I'm a pediatrician, so I'm pretty. I'm not into using titles because babies and kids don't really care, and that's fine by me. I'm just wanted to say I'm really fortunate to be able to work in Toronto and Treaty 13 territory. I grew up on Treaty 6, Treaty 8. I grew up in Athabasca, Alberta, and there's a friendship center there. Maybe there's folks that will see this from there, but I'm really happy to be here today. I think I think a lot of the questions that we'll probably get today, we'll get at more in depth. Some of the things that I hear, but I think the thing that I want to impress upon people is that the COVID vaccines are safe and effective. The other piece I want to that I hear a lot when I speak with families is the concern about how fast vaccines were developed and whether or not that means that they are still safe. And certainly based on multiple clinical trials and the information that we have from nearly, I think it's around 6 or 7 billion doses that have been given so far. We do think that they're safe and effective. So I think we'll get into greater detail about those things, but those are the big pieces that I impress upon families. And the last thing is that I always say that it's your choice. You have the choice of what you put into your own body, and then by proxy, you have a choice of what you put into your child's body. And I want to make sure that you have all the information in order to make that choice for yourself. And for me, as pediatricians, we always want to support what families and communities think are best for them, and that's part of my job. So thanks, and sorry, Brent, I totally cut you off there.
Oh, no worries. And honestly, I don't have too much more to add other than that. I think my take-home points tonight were going to be that the vaccines are safe and effective, and kind of helping sift through some of the misinformation or perhaps conspiracy theories that were referenced earlier, and help provide some information around that, and how to find actually useful information and information that's accurate, particularly when we have social media. That's just really a lot of information that's thrown around, and there's a lot of noise out there. So those are the main takeaways that I'm hoping to bring tonight.
Great. So maybe I'll start with a very simple question alluding to what Dr. Giroux, sorry, was saying. So are COVID-19 vaccines safe for children?
So I guess because I kind of brought it up, I'll start. So yes, the COVID-19 vaccines are safe for children. I will say that there's many different types of COVID vaccines and a few different brands, if you will. And the current one that we focus on in the 5 to 11 age group is Pfizer. So that vaccine has been shown to be safe and effective in the 12 plus age group. So when we're talking about kids, teenagers, and as well as the 5 to 11 age group as well. The 6 month to 4 year age group has not had approval in Canada yet for the Pfizer vaccine. There has been trials that have shown that it is safe in this age group, but it is not particularly, it doesn't work as well, particularly in the toddler age group. So that's why we're not seeing that available for 6 months to 4 year and 11 months. But the 5 to 11 and 12 plus age group, the Pfizer vaccine is approved and safe for this age group. The other thing is the Moderna vaccine is one you may have heard, and there is some approvals coming through. I think it's been finally approved in this age group, but the preferred vaccine in this age group would be the Pfizer vaccine. And the reason is the difference between some rarer side effects like myocarditis and pericarditis, which I think we'll be talking about at some point during this talk. So.
Yeah, I have nothing else to add to that.
And so maybe just kind of a bit of a follow-up. You did mention that there are multiple different types of vaccines. Do you find there is a difference between, say, an mRNA and then I don't know what other like non-mRNA vaccines?
Yeah, so when it comes to children in particular, there really are only two options that are approved in Canada at the present day. And so those are mRNA vaccines that are produced by Pfizer and Moderna. And so some of the other vaccines that people maybe heard about, or maybe if you're in an older age bracket, maybe you've received those vaccinations, those haven't necessarily been approved for use in children.
Great.
For sure, agreed.
So it seems, folks, things are opening up, mask mandates are lifting, some of the requirements for vaccines going into public settings are lifting, including maybe some for children's sports or children's activities, other kinds of activities. People generally are kind of saying, maybe the COVID, the worst of it is over. So why do children need to be vaccinated in the first place, or do they even need to be vaccinated? I'm not sure what you would say to folks if they're posing that kind of a question. Did you want to go first, Dr. Young?
Sure. Yeah. So I think certainly there are signs that things are improving with the COVID situation, and we know that things like mask mandates are kind of starting to lift, at least here in Nova Scotia. I'm not sure what the situation is in a lot of other provinces, but it seems that a lot of those mandates are lifting. And I think if things continue on this trend, it looks good for the pandemic, and hopefully we'll be coming out on the other side of it, knowing that there are still good measures like wearing a mask is still safe, it's effective in preventing transmission of the virus. And so just because the mandates aren't necessarily there doesn't mean that we can't continue to do those things to keep ourselves and our community safe. The thing with the vaccines though, and children, is that we know that the vaccines, depending on the variant, and even with the Omicron variant, the vaccine is still somewhat effective, not compared to previous variants per se, but it still is effective in preventing infections. And so, but what we're really actually concerned about in a lot of cases is preventing the more severe COVID infections. So infections that lead to hospitalizations or severe outcomes like multi-system inflammatory syndrome. And so these are things that are specific to kids, and we know that the vaccine helps prevent those types of things. And also we know that children are more likely to have asymptomatic infection, and so potentially more likely to carry it around to family members or community members. And so anything that we can do to help prevent some of those more significant outcomes, particularly with vaccination, I think is pretty powerful and pretty important, regardless of where we are in the response to the pandemic.
I agree, and I have a couple of things to add to that. So unfortunately, a lot of people say, "Oh, well, isn't the pandemic over?" And I want to break the ice and say I do not think this pandemic is over. Certainly, something that we look at whether or not the pandemic is kind of shifting into COVID being something called endemic. So where it becomes something that's kind of always around but not as severe, or always around and we're not kind of in such a phase where we're putting a lot of resources, time, and effort into containing containing transmission of the virus. So sometimes I think about, like, if we think about influenza, that's kind of more of an endemic as opposed to a pandemic, right? I have to say, just to add on a little bit more to if the pandemic is over, we're seeing different waves in many different countries outside of Canada that are dependent on so many different things. It includes the vaccine uptake, public health measures like masking and social distancing, among other things. So, right now in Hong Kong and Denmark, they're seeing really big increases in the number of cases, as well as the overwhelming of their hospital systems. And it's the same month as we are experiencing less, right? And it has to do with many different factors. So I don't think that the pandemic is over, but I do hope we're moving more towards that endemic phase. The other thing is, a lot of families ask me, if kids are low risk of getting really sick, and everything is kind of going back to normal, like, what's the point, right? Why would I get a vaccine for my kid? And I kind of think about it in three different ways. So I think about it for the child themselves. I think about for those around the child and the community, and then I think for the future. And to expand on each of those things, for the child themselves, we know that it's true that many children, many adolescents, and young adults are at low risk of developing serious consequences due to COVID. And most people will either be asymptomatic, which means they have no symptoms, or they'll kind of have symptoms that are similar to the flu or having a cold. But I can never guarantee to any family that risk will be zero, that they won't have a serious consequence. There are many young people, including young kids, who've experienced significant illnesses, like having to be admitted to the ICU, needing a breathing tube, lots of other things that happen when someone is really unwell. And the COVID vaccine is designed to help prevent that. So we know that someone who's gotten the COVID vaccine is much less likely to be admitted to hospital and to ICU compared to someone without it. And Brent had mentioned this just briefly. There's something called multi-system inflammatory syndrome caused by COVID. So we call that MISC. It's a COVID-related disorder that's specific to children and adolescents. We know that youth who are admitted with MISC have a 1 in 3 chance of being admitted to the ICU, especially it's increased if they're unvaccinated. And COVID vaccines are one thing that helps prevent this with youth, and there's studies ongoing that look at MISC and vaccines in the younger 5 to 11 age group right now. So these are some things that's something that's very specific to children that maybe we don't think about in the adult population, but certainly I've taken care of many children who've been admitted with MISC, and it's something that's not very pleasant, and I really wouldn't wish it on anyone. So that's the kind of for yourself piece. The middle piece is for those around us, right? Our families, our communities, people that we work with or play with, people in children's classrooms, right? So there are others around us that may not be so lucky to have good health, right? And that's for lots of different reasons. And some of these, especially our older family members or our elders, some of these people have health conditions that actually prevent them from being able to get the vaccine, or have conditions that mean the vaccine doesn't work very well for them. And one way we can help protect our families and those in our communities is to get vaccinated to reduce the transmission between people. We can also contribute in other ways, right? So if someone decides that the vaccine isn't for them, using masks, washing our hands, isolating when we aren't feeling well, and also giving someone the opportunity to say, I don't feel comfortable maybe with having someone who's unvaccinated or who has symptoms be near me. So those are some things that we can do for those around us in our communities. And the last piece is that future piece, right? I think I'm not alone when I say this pandemic has been really, really, really unpredictable. I remember back in March of 2020, I was like, oh, it'll be a couple months, right? And here we are 2 years later. So back in November, for example, before Omicron, there were lots of folks that thought at that point that we were over the worst of the pandemic. And then very rapidly, Omicron started to spread across the world and led to many people around the world getting an infection. And people who were unvaccinated at that time, they didn't have that much time to actually get their vaccines, because a primary series of a vaccine takes about 5 to 6 weeks to be considered fully vaccinated. And because of that, these folks are at higher risk for transmitting, as well as being admitted to hospital or having COVID-related symptoms. So we don't know where this pandemic is going to take us. There's maybe another variant that comes along, and it could be worse than the previous ones. And my take on it is the best way to protect ourselves is to be prepared. And I think out of all the options that I have, the vaccine's the most effective way to do that based on what we know right now. So that was a super long-winded answer, but I think those are some of the key pieces that I try to impress upon us, and why it's actually important for children to still get the vaccine.
I appreciate that. You can take as much time as you need. I think you covered a lot of ground, and I think it's a lot of what you touched on is what's on a lot of people's minds, right? And certainly, even for myself, watching what's circulating online and what's being kind of sort of the algorithms, what I'm getting fed, but then seeing what other people are being fed, and trying to address things in a kind way, from not just a name or a face or a link on the internet to, okay, what are real people actually experiencing, and folks that are on the ground, like both of you, right? And for you, Dr. Giroux, Dr. Young, I think I'm going to preface it by, just touching on the idea of the vulnerabilities, and certainly within Indigenous communities, that was a big reason why we wanted to have sort of our own messaging, our own key messaging, because there's not just the pandemic that we're dealing with. We also have issues of overcrowding in some of our communities and our homes, even within the urban settings. But then we also have the issue of systemic racism within the healthcare system. And so regardless of, how people are experiencing the pandemic and through the vaccines, we did not want our peoples to have to be forced to use a healthcare system that might also not care for them in the ways that they should be. And so I don't know if you just want to draw, I know the clinic in Halifax and the Mi'kmaq Friendship Center is new, but I don't know if there's anything you want to maybe touch on from that perspective about providing that community care that's not just the medical, vaccine piece of it.
Yeah, I think what you mentioned is actually quite accurate. And so we're often in our communities, like we live in very close-knit communities. So the risk, I think, is much higher if one person gets infected. I think there's a higher likelihood that many people in that community will be exposed and then subsequently infected. And so and then the overcrowding issue, where we have homes with a lot of multi-generational families and other people living in the household. So when one person becomes sick, it becomes very difficult for somebody to isolate potentially. And then there are issues around things like medications and whatnot, being able to access medications or the pharmacy or healthcare in a timely manner, especially if you're living in a rural or remote community as well. And so I think what I'll say is that in the care that we're trying to provide, both in my clinic. I also work at Sebeganegedy, which is a reserve about 40 minutes outside of Halifax, and eventually in our newer clinic that we're hoping to establish at the Mi'kmaq Native Friendship Center. Is that really it's about meeting people where they're at and trying to accommodate all of their health care needs. And so in some senses, we've been able to, in Sebeganegedy, for instance, have set up a testing site right in the community, have vaccination clinics available in community, and really just addressing kind of all of those barriers that people would face in terms of being able to access care. And then, of course, there's the kind of cultural aspect of things, and certainly that's something that we're very focused on at the Mi'kmaq Native Friendship Center, is being able to incorporate culture in the care that we provide to Indigenous folks when they come to our clinics. And that may not necessarily be the role of a physician in the clinic, depending on who that physician is, but at least having access to things like elders who may be trusted by the community to be able to provide some explanation as to the importance of kind of working together to fight COVID, whether that's with vaccination or other measures that we take. But that's all I think that I have to say on that front.
Appreciate that. I think that was something that we've touched on in previous webinars when we had Dr. Janet Smiley on, where it was this idea of, we're not promoting or we see the value in using both the Western medicine and this vaccine that's been developed, but also using it in part and parcel with our traditional medicines. And maybe we think about, we might have to do it a little bit differently for now, in terms of like sweat lodges and pipe ceremonies and those kinds of things. But, when we look at things like diabetes and cancer care and other kinds of sort of chronic illness or other illness, we have a lot of really good examples of where communities and people are drawing from the best of both worlds to feel healthy and to feel comfortable. And I've seen that within our communities with COVID as well, where we want to continue to encourage people to, yes, be using traditional forms of medicine as well, because it helps us with other aspects of health that aren't going to be addressed just through a vaccination, right?
Yeah, I think, and sometimes going to a non-Indigenous health center or a non-Indigenous provider, you may not necessarily be met with understanding. And I think Indigenous people understand that. And I think that's why it's important that we have our own services that we're designing and implementing as peoples to be able to incorporate some of that very important aspects of our lives that aren't necessarily understood outside of our communities.
I want to refocus a little bit on some of the risks and the side effects. Certainly, it's gone around the risks of specifically myocarditis from the vaccine. Could you maybe unpack that a little bit, and then maybe as a follow-up, are there other side effects or other risks that people might just want to be aware of, or where they can find more information?
Yeah, maybe I'll take that one. So definitely for adverse effects or for side effects, anything we put in our bodies, there may be a side effect, there may be adverse effects. And that's why we monitor them really, really closely. Because of how fast the COVID vaccine was developed, a lot of different organizations have been monitoring vaccine-related side effects of the COVID vaccine. And the vast majority of side effects are things that are very common with other vaccines, right? So pain in the arm, right? Very common. Feeling tired, having symptoms that feel like a flu. Those are some of the most common side effects. You mentioned pericarditis and myocarditis, and that's one that I do like to just mention specifically in this age population. So what those are, that's inflammation of the heart muscle, or the kind of the bag around the heart that the heart sits in. The pericarditis or myocarditis is the most commonly seen in people who are younger, especially teenagers, and more so males over females. It's still considered a rare side effect. So the last time I looked at some of the numbers, it's more than 10 million children had received the vaccine in the US and Canada, and there was only a small number of reported and confirmed cases. And these cases are typically pretty mild with no long-lasting effects on the heart. To give some context, we have seen myocarditis and pericarditis in children for before the COVID vaccine existed. It's something that we see with many different viral infections. And COVID is actually pretty similar. You're actually much more likely to get pericarditis or myocarditis after you get a COVID-19 infection compared to getting the vaccine. Some other things that people ask me if there's any relation to brain development or to puberty or to fertility. Those are kind of the three that I get asked about as a pediatrician. But what we know based on the effect or the COVID-19 vaccine monitoring is that there's no known effects on brain development, puberty, or fertility. And maybe I'll just jump in here to talk about kind of long-term side effects, because I think that's something that often comes up. Because I think it's pretty reasonable to say, okay, well, if this vaccine has only been around for a year, let's say, how do we know that 20 years from now you're not going to, I don't know, grow an extra limb or something like that? So I think it's a really reasonable question to ask. And so to give some context, coronavirus vaccines, so COVID-19 is a type of coronavirus. They've been in study for almost 20 years. And for the COVID-19 specific vaccines, research literally started in March 2020. Like, we're like, pandemic happened, and then it's like research. That's where the focus is. So we're trying to get out of this. So we have data now for 2 years. Plus we have data from, I think it's actually 13 billion doses that have been given around the world. Most vaccine side effects of influenza vaccines or routine childhood vaccines are expected to show within kind of hours to days, and sometimes they'll show up a few weeks later. It's essentially unheard of for a side effect to show up after a few months of receiving the vaccine. And part of that, if we think about mRNA vaccines, which are the COVID vaccines are mRNA vaccines, the actual vaccine is degraded really, really quickly in the body. And then the body takes over producing the immunity. So based on the experiences with other different vaccines and how we know that mRNA vaccines work, we wouldn't expect to see long-term side effects in any case. So that's how we think about how it works mechanistically and kind of go forward. So I hope that's helpful in thinking about some of the vaccine side effects.
Helpful for me. I'm hoping it's going to be helpful for those who are tuning in and listening. When maybe this is a bit of an aside, when they're actually putting the vaccine, there's like a little bit of liquid that's in like the vaccine. Like what's actually in that? Like what are they actually putting into you?
So I would say I don't know the exact list for every vaccine, but every vaccine is probably a little bit different. But oftentimes there'll be agents mixed with the vaccine to help preserve the vaccine, to make sure that it's stable enough to make it from the factory to the clinics and into the arm of the patient. And so all of the components of a vaccine, when we talk about safety, all of the components of the vaccine are really what's incorporated in those safety trials.
Maybe I'll just add in here. I've had some families ask me like how mRNA vaccines actually work, because they're a little bit different. And I've actually had families ask like whether it's like a gene therapy, because it has something that kind of sounds like genetics. So the way that I describe it is mRNA is kind of like half of DNA, and it contains some instructions on how your body, how a cell would produce something called a spike protein that looks really similar to the spike proteins that we see in COVID-19. So essentially what happens is when we give the vaccine, the mRNA enters into the muscle cells. It doesn't go to where your muscle cell's DNA is. It kind of stays floating in the other part of the cell. And then it contains the instructions for that cell to start making the spike proteins. The spike proteins are then on the outside of the muscle cell, and then your body, normal immunity will just say, oh, hey, there's this thing that I don't really recognize, and then to start to produce immunity towards it. It produces antibodies. We know that the mRNA is only there for about 3 days in cells, and then the spike proteins last maybe a week or two, and then they're gone. And then your body has taken over. They're like, well, I've seen this before. So if you're exposed to COVID, your body's like, I've seen this before. It's a spike protein, and then it goes and helps get rid of it. And that's likely why we're seeing, differences in how severe infections are for those who are vaccinated, and then you may not be, and also for preventing transmission. So that's kind of how it works. Is a simplified version. Is certainly more complex, probably more complex than I can completely understand, but that's a general sense of how it is. mRNA is kind of like a instruction manual.
And when you're talking about, you just mentioned the transmission, and I think that's another question is, if I vaccinate my child, does it actually do anything for helping in the spread? Because I've heard certainly people say, well, even people who get the vaccine are still able to get COVID and transmit the virus. So part of it is why bother, but another part of it is either implying it's not working to the extent that it should be. So I don't know if there's anything that we can share just with respect to transmission and still the use of the vaccine.
Yeah, with the new variant Omicron, the vaccines certainly are a little less effective in terms of preventing infection and subsequent transmission of COVID. But still, there is some effectiveness to the vaccines in that regard, and so there is that benefit of it. But when I talk to people, I often explain that the real benefit for these vaccinations is actually outside of the prevention of infection and transmission, is actually to prevent severe illness or hospitalizations. And so really that's kind of the end goal when we're trying to vaccinate people. Certainly it's a bonus that we get that protection from transmission. It actually was quite helpful in previous waves when there were other variants that the vaccines were more effective in preventing those infections and transmissions. But certainly we do want to prevent children from having severe infections related to COVID.
Yes, maybe we can look at some of the longer term effects. So you've already mentioned that the vaccines do help reduce the severity, but I'm wondering if you've seen instances of long COVID, either from children who both have been vaccinated and haven't been vaccinated, and maybe kind of unpack what that means, like long COVID, and does the vaccine help with any of those types of issues?
Maybe so maybe I'll start with the pediatric perspective, and Brent maybe can speak to just long COVID in general. So I have to say that long COVID is something that has been kind of described by many different folks, and it's kind of an active area of study for people who are researching COVID and the effects of COVID. So it's not very well defined, but certainly it's kind of defined as long-lasting symptoms that are kind of beyond the acute infection of COVID. The most common things that I've seen, that I've heard of, are things like prolonged fatigue, being really tired, difficulty concentrating, things like that, and perhaps Brent has a little bit more experience because the likelihood of a child experiencing long COVID is lower than those in the adult population. I think kind of when long COVID was starting to be described, I think there was a sense that it's possible that children would also kind of get that long-lasting effect. But certainly what some of the preliminary studies have seen is that it's certainly still something that I would say is not common. And the other thing that I just wanted to bring up is when we think about long COVID and some of the symptoms like fatigue or difficulty concentrating, there's a lot of overlap between that and other more defined conditions. So if we think about things like anxiety, depression, we think about things that are affecting especially children and youth right now, there's a lot of overlap. So if someone has had COVID and then 12 weeks later, let's say they're feeling really tired, they're also living in the context of a pandemic where they're maybe not going to school in person, they're not seeing their friends, not getting physical exercise, they're not seeing their community, their elders, their grandparents, things like that. So there's a lot of overlap between what we see in long COVID and in what we see just as a result of the difficulties of living in a pandemic. So I think overall, it's still, for children at least, long COVID is still something that is being monitored, but the general sense is that long COVID is less likely to occur in children. But I'll pass it on to you, Brent, maybe if you had a bit more about how maybe in the adult population, long COVID is affecting parents, which, parents and family members, definitely the effects of long COVID could be felt by children in that sense.
Yeah, it's as you mentioned, I think it's the symptoms are quite broad and in some cases general symptoms that can be attributed to other things. So I think there's a lot of work being done right now to understand what long COVID looks like and kind of identifying that type of syndrome. And so in adults, similar symptoms that you mentioned, like fatigue, headache, mental fogginess. Sometimes people have like myalgias or pain in their muscles or their body. And we know that the vaccines are actually effective in preventing that as well in adults, because it's much more rare in children, from my understanding. I think it's probably much harder for us to kind of make that type of determination as to how effective the vaccines are, because it's a more rare kind of outcome with COVID. So I would say that I do think there's evidence in adults that the vaccines do prevent long COVID, but I haven't seen the evidence yet that it can prevent it in children.
I agree. Jocelyn, you are muted.
2 years, and you think I would get that going, because or the pendulum swings the other way and I think I'm on mute, and then I'm kind of muttering to myself as I'm like reading one of these questions, right? So
somebody once told me that for every amount of time that somebody is unknowingly on mute on Zoom, the pandemic gets extended by that amount of time.
No.
Thank you for your contribution.
I am sorry for contributing. No, I mean, I'm appreciating the conversation. We're covering a lot of ground and the things that at least we had as initial questions from what we've gathered just from our contacts. And I think maybe I want to look back again to this idea. So we've kind of covered sort of like, the process and the medical pieces of the vaccine itself, the symptoms or the side effects and the risks and all that kind of stuff. We touched a little bit on sort of, I guess, the societal pieces of it, but I might want to like just circle back and kind of dig in a little bit more, because I mean, there certainly has been this aspect of trust and trust of the government in particular, and we've even seen it when we were advertising for this webinar, where we're providing information from a community perspective, but a lot of people were interpreting it as we are sort of advancing government propaganda or something like that, or I don't trust the government. And I mean, there's a very real aspect of that for Indigenous communities, right? Like we have evidence in very, very recent history of medical experimentation, non-consensual medical procedures, forced sterilization, things like that. So I mean, it's a very real thing, and it's a risk that exists. So I think people have maybe a question or kind of double think when it comes to this, to say, well, how do I know, like, how can I trust this, or how is it that this is different in a different aspect? And I don't know if maybe that's a little bit too higher level, but I'm sure it comes up in the people that you talk to every day, and I don't know if you have any reflections or thoughts that you want to share on sort of those pieces. I mean, I was just gonna say, Dr. Young, maybe you can start.
Yeah, and honestly, like I understand where that comes from, knowing the history and all of the terrible things that have been done to our communities by the government and by other kind of organizations or institutions. And my family has had its own experience with this. Like, my grandma was a residential school survivor, and my mom was a 60 scoop survivor. So I personally am very skeptical of the government, other positions of authority. And so as a physician, my job is to look through the evidence and the information that we have. And so the evidence and the information that we have comes from a whole variety of sources. And we're lucky in a sense today that we can access that information online, whereas in the past you might have to like subscribe to a journal, go to the library, like those types of things. I don't even know how doctors used to do it, to be honest with you. But we have access, like, at our fingertips to all of this information that's what we call peer reviewed. So other scientists and other experts look at the information before it even gets published, and they critique the information and whatnot. And so there's that kind of process happening behind the scenes. And so as a physician, my job is to look at all of that, and then with that information, make a recommendation that's tailored to the needs of my patient. And so and at the end of the day, as Ryan mentioned earlier, the decision is always my patient's decision. So I'm not forcing anybody to do anything like take a vaccine or give a vaccine or make their child take a vaccine, but I'm laying out the information that I know is the best source of information that we have. And that's how I approach it. And I think it's very much complicated by the things that we see on social media. And it's so hard to know what is a trusted source, what isn't a trusted source, when you're not doing that on a daily basis like a physician would. And so I think I understand why people are sometimes scared or apprehensive about a lot of this. But I think it's important that if you have somebody who's a physician who is trusted, that you talk to them about your particular circumstances and make an informed decision for yourself or for your child. Ryan, did you have anything else?
Yeah, no, I think that's excellent. A really good point. And the only thing I'll add to that is, what I've seen with this pandemic and decision making in this pandemic in the context that I work, is that I think there's a lot more autonomy and power given to our communities to decide what's good for us, compared to even if this would have happened, 5 or 10 years ago. So I think you mentioned, Jocelyn, at the beginning, that I work at Adoje Minonesewanong, the Place of Healthy Breathing, which is our Indigenous COVID testing and vaccine center in Toronto, and we service a very wide range of Indigenous folks from across this land. What I've noted during my work with Adoje is that we take the time to help interpret what we see in the science and how we apply that to our community and our people. And then we kind of become, hard to describe, but we kind of become our own public health unit. And we help to make decisions on, what we would recommend being best for our community, and whether that be, for us, we would take a look at, the timing between first and second doses, and would say, well, what would make the most sense for our community if someone wants to get it earlier than what was initially 8 weeks, right? We take a look at, how do we make sure that people have the best information and things that actually make sense to them? How do we make sure that our community members are able to access the vaccine if they want to, when there are lots of different things that prevent them from being able to? So whether that be actually getting them a taxi or an Uber to come to our center, or whether it be in-home vaccines that would make more sense. And also kind of, if someone does have COVID, building that trust in that community and saying, hey, we heard, like, we were helping you get your test. We know that you have COVID. Can we bring you a food box? Can we bring you extra supports? Do we need to get you linked up for someone to make sure that your health is okay? So, it's about building those fires and building that community. And I think that's something a lot different now that we're having a lot more sovereignty over our health. And I totally agree. I've had many different Indigenous families of mine that are really hesitant, and I say, you know what, like, I'm here to talk about it whenever you like, and it's never a problem for it's never like a, oh dang, I didn't get that vaccine. It's I'm here to build community with you, and I'm here to give you information. And I've had some families, after I've talked to them multiple times, say, you know what, I think I'm ready. I have families who haven't, and I think that, I'm just happy that they're coming back, and that we can build that relationship. So I do think that's that it's different than if we would have been having this in like 5 or 10 years ago. But yeah.
I appreciate that. And I think we've tried to take the same type of approach with friendship centers. So obviously, not all friendship centers have a full health clinic like Odoje or like the one that's being built at the Mi'kmaq Native Friendship Center. But we have that sort of same principle of being the vaccine clinics, is that it's a culturally safer space for people. It's a place of understanding, and it's a place where people will be real with you about, how they can help in other ways. And sometimes it's not about vaccine hesitancy, so to speak. It's about systemic barriers and access to quality and culturally appropriate healthcare and supports. And so we wanted to make sure that wouldn't be a barrier for our peoples and at least the communities that friendship centers are serving across Canada. I'm allowed to do those kinds of things because we sponsor the the webinar. But I mean, that aside, we have been really proud of the way that friendship centers have responded during this and providing that wraparound community support, including offering the vaccination clinics. So I think I just want to maybe look at a couple more questions, and then we'll wrap up on that. But I'm kind of thinking about like longevity and immunity, and from what we know now, what can we expect of how long this will last? I know for myself, I've got 2 vaccines plus a booster, right? Do we think, or do we know right now if that's going to be a similar sort of trajectory for children, where we might, 1, have to look at boosters, and 2, maybe look at annual vaccines like we do already with like the flu shot, for example? I don't know if Dr. Giroux, if you want to start on that.
Sure. Yeah. No, of course. So I would say that, the natural, like the immunity given by a vaccine or the immunity given by a COVID infection does decrease over time, like within both of those situations. How long it takes is really probably due to a number of different things that have to do with a person and their own different factors, and also likely has to do with, if it was an infection versus if it was a vaccine. The numbers that I typically think about is for vaccines, I think about kind of around 6 months is where my head goes to, but certainly that could be different between different people. And that was kind of originally, when the first boosters were offered, it was kind of like, 6 months after after the initial primary series. For natural, or I wouldn't say natural infection, for a COVID infection leading to immunity, somewhere between 3 to 6 months is kind of what I'm seeing as well. So in terms of whether or not this will lead to needing kind of additional vaccines, it's hard to say. It really depends on where we get to in that endemic phase that I was talking about before. But I would say that my guess is that it will probably end up being something like that. However, with flu vaccines, for example, like it's not like we have a flu vaccine card to get into places, right? So certain professions, such as healthcare providers, are expected to get the flu vaccine or have to do a number of different things in order to protect their patients. So that there are maybe some restrictions on specific people. I don't know. My guess would be that it would be kind of offered on those either yearly basis or 6-month basis. I'm not too sure, but certainly it's something I'm interested to see what happens, but I don't have a for sure answer. I have no insider knowledge. I totally wish I did, Jocelyn. I'd love to tell everyone that, but nothing that I know of so far. Maybe Brent, do you got any insider knowledge there?
No, I have no insider knowledge. I do not. But yeah, I would agree with what you said. It's hard to say exactly how long the immunity will last, and I think that another factor that we need to think about too is the potential for future variants, and so how effective our vaccines will be against those variants, and how we'll be able to adjust our vaccines to fight those variants. I think will be a key factor in determining how often we're getting boosters. I think certainly it's safe to say we will be getting boosters. The question is just at what frequency are we expected to be getting those? And yeah, and as you mentioned, Ryan, I don't know if, depending on how severe the situation is, I don't know if we'll ever be going back to like the vaccine passes or passports that people have been calling them, but it's really hard to say at this point.
So we've gone through our audience questions. There was one that was asked, and I just wanted to mention it, that I think there's a little bit of confusion about what exactly it was referring to. So we'll take it back, and if there's something that we can add to that question, we can commit to following up after this. But yeah, we've gone through all of the questions that we had, and maybe I just want to offer sort of a last opportunity to cover anything that you might have maybe wanted to add on, or if you wanted to we missed, or just an opportunity for either one of you to kind of add on anything. And if not, if you have any final thoughts or reflections just based on the conversation that we've had.
Oh, we both unmuted at the same time. Uh-oh.
I know I was supposed to identify one person, and I said I would, and I didn't. I apologize.
It's all right. I wanted to say, I saw the question about the authorization versus approved in the monograph. So I'm not sure who asked this question. I'm not exactly 100% certain what kind of information that you're looking for. Certainly the monograph for the Pfizer vaccine, the most up-to-date version was updated in March. So I'm wondering if the monograph that you're looking at is not the most up-to-date version. But I'm not sure how to answer the question versus authorization versus approved. So I wish I did, because I would love to try and answer that, but yeah, beyond that, I think one thing that I really want to impress upon folks who are listening is, especially for us who work with the community, or have or who work within COVID testing or vaccine centers, like a lot of it is even if you're unsure, like being able to talk with someone about it and help to dispel those myths, or help to say, yeah, that's like totally a great point. I think those are important. Like, you know, not everyone who comes into a doje has kind of drank the Kool-Aid, right? Like there are people who are hesitant, who, you know, stay for a 15-minute conversation and still want to think about it. And I think that is totally fine. And I'd rather just have someone talk about it, and then they know. I want to give them all the different things that they can do to help be safe. Vaccine is one of those, and one that I recommend highly, but it's certainly not the only thing that we can do. So that's the piece I wanted to just make sure that people understand.
Appreciate that.
Yeah, I didn't have much more to add other than that. I think I would say the same thing. I'm always open to chat with my patients about the risks and benefits of not only vaccines, but any treatment that we're recommending in our clinics. And so I would hope that the folks listening tonight have access to a provider who they feel comfortable with and are able to ask those very important questions and make a decision for themselves and for their child as well. But no, I'm very grateful to have been here tonight, and this has been great. And I'm hopeful that I'll be able to come back, and maybe we'll be chatting about something else some other day. Maybe we'll be on the other side of this, and it'll be something great that we're talking about.
You're one of us now, so we definitely will. We would love to have you back anytime, and if there's something that you want to do, we would love to have you host that. The conversation kind of reminds me of something that I actually used to present in workshops across the country and in the United States. And it was about this idea of the cultural competency continuum, about, understanding where you're at within a community, and when you're interacting with Indigenous peoples, and approaches to, I don't want to say reconciliation, but like approaches to addressing issues that have been longstanding within our communities. And one of the analogies was the cure for the common cold, right? You could tell somebody that something is good for them, but one of the worst things that you could do is just force your remedy onto somebody if they don't want it, if they don't feel comfortable, and if it's not part of their worldview or where they're coming from. And I think we've taken that principle to heart in terms of what we've saying. Certainly the information, the data that we have, and really why we've gone to Indigenous practitioners and people who are working in community is for those very reasons, so that anybody who's watching, anybody who might view this later, can see people who have come from the communities that they come from, understand that history and that past, and are saying, we understand the hesitancy, we understand the volume of information, we get it, because that's us, that's our communities, that's our families, we get it. And we still think that this is the best way to go, based on the information that we have available to us, right? Healthy criticism of government here, healthy skepticism of approaches when people say things are good for us, right? But I feel more confident the more I speak to Indigenous practitioners, the more I speak to people who have that experience on the ground, and talk to people like me, like us, like our communities every day. And so I just want to thank you both for coming and sharing your knowledge, for doing the work that you do in community. And of course, I'm hoping if there's any way that we can support that work and continue to do that work, we're here. And for those who are watching and listening, we have tried to consolidate and curate information that we view as coming from good sources, trusted sources, on our website, NAFC.ca. If you go under programs, we have a section specifically on COVID-19 where we've put information that we feel comes from a good place, and that our communities can trust and rely on. And so if you were watching and were part of this, we actually have some prizes and some gift cards. So fill out the survey for the chance to win. There's a $500 gift card, there's two $250 gift cards, and there's 5 $100 gift cards. So yeah, that's definitely worth filling out a survey to have a chance at one of those gift cards. And thank you all for joining, and keep your eyes open for the next one. And of course, if there's any questions or things that we didn't get to, please feel free to follow up with us. I think that's it. We'll sign off for today.